Welcome to Medicare 360. I'm your host, Jennifer Lee. Let's get started. We are still on the Medicare New Handbook. We are at page 38. We left off on preventive services, diabetes screenings. So, Medicare does cover up to two blood sugar laboratory test screenings, fasting or non-fasting each year if your doctor determines you're at risk for developing diabetes. You pay nothing for the test if your doctor or other qualified healthcare providers accepts assignments. So now we're at page 39. We're still on preventive service diabetes self-management training. Medicare does cover diabetes outpatient self-management training to teach you to cope with and manage your diabetes. The program may include tips for eating healthy, being active, monitoring blood sugar, taking prescription drugs, and reducing risk. You must have been diagnosed with diabetes and have a written order from your doctor or other healthcare provider. Some patients may also be eligible for medical nutrition therapy services, page 45. You pay 20% of the Medicare approved amount. The Part B deductible applies. So note, if you are in a rural area, you may be able to get diabetes self-management training from a doctor or other healthcare provider through telehealth. Visit adces.org/program-finder to find certified programs near you. Doctor and other healthcare provider services. Medicare covers medically necessary doctor services, including outpatient services and some inpatient hospital doctor services, and most preventive services. Medicare also covers services you get from other healthcare providers like physician assistants, nurse practitioners, clinical nurse specialists, clinical social workers, physical therapists, occupational therapists, speech language pathologists, and clinical psychologist. Gosh, I can't even say psychologists. No, psychologists. Except for certain preventive services for which you may pay nothing. Psychologists, okay. You pay nothing if your doctor or other provider accepts assignment. You pay 20% of the Medicare approved amount for most services. The Part B deductible applies. For some reason, that was like a tongue twister for me today. So yeah, definitely. Okay. Now let us go on important. If you haven't received services from your doctor or group practice in the last 3 years, they may consider you a new patient. Check with the doctor or group practice to find out if they're accepting new patients. Drugs. Part B covers a limited number of outpatient prescription drugs like most injectables and infused drugs when licensed medical provider gives them. Certain anti-cancer drugs, drugs used with some type of durable medical equipments like nebulizer or external infusion pump, intravenous immune globulin for use in the home, FDA-approved pre-exposure prophylaxis, PrEP medication for HIV prevention, certain drugs you get in a hospital outpatient setting under very limited circumstances. Most renal dialysis and biological products, page 44. Note, other than the examples above, you may pay 100% for most drugs unless you have Medicare drug coverage Part B or other drug coverage. Go to pages 79 and 90 for more information about Medicare drug coverage. For some drugs used with an internal infusion pump and for intravenous immune globulin for use in the home, Medicare may also cover services like nursing visits under the home infusion therapy benefit and the intravenous immune globulin benefit, page 44. Part B also covers some injectables or implantable drugs to treat substance use disorder when a provider administers them in a doctor's office or in an outpatient hospital setting. You pay 20% of the Medicare approved amount for these drugs. The Part B deductible applies. You won't have to pay any co-payments for these services if you get them from a Medicare enrolled opioid treatment program, pages 47. Doctors and pharmacies must accept assignment for Part B covered drugs, so you should never be asked to pay more than the coinsurance or copayment for Part B drugs itself. Important, your coinsurance can change depending on your prescription drug prices. You may pay lower coinsurance for certain Part B covered drugs and biologicals when you get them in a doctor's office or pharmacy or in a hospital outpatient setting. Their prices have increased higher than the rate of inflation. The specific drugs and potential savings change every quarter. If the Part B covered drugs you get in a hospital outpatient setting are part of your outpatient services, you pay a copayment for the services. Part B doesn't cover self-administered drugs in a hospital patient setting. Self-administered drugs are drugs you normally take on your own. What you pay for self-administered drugs in a hospital outpatient setting depends whether you have Medicare drug coverage Part D, or other drug coverage, and if the hospital's pharmacy is in your drug plan's network. If you have other drug coverage, your drug plan may cover drugs that Part B may not cover. Contact your drug plan to find out what you pay when Part B doesn't cover the drugs you get in a hospital outpatient setting. Durable medical equipment, DME. Medicare covers medically necessary items like oxygen and oxygen equipment, walkers, and hospital beds when a Medicare enrolled doctor or other healthcare provider orders them for use in home. You must rent most items, but you could also buy them. Some items pay your property after you made a number of rental payments. You pay 20% of the Medicare approved amount. The Part B deductible applies. Make sure your doctors and DME suppliers are enrolled in Medicare. It's important to ask your suppliers if they participate in Medicare before you get DME. If suppliers are participating suppliers, they must accept assignment, which means they can charge you only the coinsurance and Part B deductible for the Medicare approved amount. If DME suppliers aren't participating and don't accept assignment, you may have to pay for the full cost of the DME. I would say on this, sometimes when your doctor does refer out your durable medical equipment items, sometimes it does fall through the cracks. So you definitely need to follow up with your doctor to make sure that it's completed. And sometimes it does take a little bit to get this going. So if you really need those items, I would just stay on top of it. A lot of questions I do get is, are scooters or like electronic wheelchairs covered? And you know what? Most of the time they're not. So it's something privately that you do have to get. And people ask why. I think maybe later, before, there was a lot of fraudulent things going on with that, but that the scooters or electronic wheelchairs are really not covered that I've seen with vendors. So let's get to page 41. Electrocardiogram, EKG, or ECG screenings. Medicare covers a routine EKG/ECG screening if you get a referral from your doctor or other healthcare provider during your one-time Welcome to Medicare visit, page 54. After you meet the Part B deductible, you pay 20% of the Medicare approved amount. Medicare also covers EKGs or ECGs as diagnostic tests, page 51. You also pay a copayment if you have the test at a hospital or hospital-owned clinic. Emergency department services. Medicare covers these services when you have an injury, a an illness or an illness that quickly gets much worse. You pay a co-payment for each emergency department visit and 20% of the Medicare approved amount for doctor services. The Part B deductible applies. If your doctor admits you to the same hospital as an inpatient, your costs may be different. So keep in mind, people do ask, well, am I covered out of state? And of course, if you are out of state, emergency and urgent care is covered on a Medicare Advantage plan with a Medicare supplement plan. Yes, definitely covered as well. So don't really worry about that, I would say, unless you're just on original Medicare, you have to pay that whole 20% coinsurance because you don't have a supplement. Let's go to e-visits. Medicare covers e-visits to allow you to talk with your provider using an online patient portal without going to the provider's office. Providers who could give these services include doctors, nurse practitioners, clinical nurse specialists, physician's assistants, physical therapists. Okay, where am I at? Physical therapists. What else? Let's see. Okay, just lost my place. Okay. Occupational therapists, speech language pathologists, and when they are for mental health care, licensed clinical social workers, clinical psychologists, marriage and family therapists, and mental health counselors. To get an e-visit, you must request one with your doctor or other provider. You pay 20% of the Medicare approved amount for your doctor or other provider services. The Part B deductible applies. Eyeglasses. Medicare covers one pair of eyeglasses with standard frames or one set of contact lenses after each cataract surgery that implants an intraocular lens. Medicare will only pay for contact lenses or eyeglasses from a supplier enrolled in Medicare, whether you or your provider submits a claim. After you meet the Part B deductible, you pay 20% of the Medicare approved amount for corrective lenses after cataract surgery with an intraocular lens. So keep in mind, people do ask if LASIK is covered, and it's not. So do keep that in mind. Federally qualified health center services. Federally qualified health centers provide many outpatient primary care and preventive health services. There's no deductible. You pay nothing. Actually, you usually pay 20% of the charges or the Medicare approved amount. You pay nothing for most preventive services. Federally qualified health centers may offer discounts if your income is limited. Visit findhealthcenter.hrsa.gov to find a health center near you. So on to flu shots, preventive service. Medicare covers the seasonal flu shot or vaccine. You pay nothing for the flu shot if your doctor or other healthcare provider accepts assignments for giving you the shot. Okay, we're on page 42. Foot care. Medicare yearly foot exams or treatment if you have diabetes related lower leg nerve damage that can increase the risk of limb loss, or if you need medically necessary treatment for foot injuries or diseases like hammer toe, bunion deformities, and heel spurs. You pay 20% of the Medicare approved amount for medically necessary treatment your doctor approves. The Part B deductible applies. You also pay a co-payment for medically necessary treatment in a hospital outpatient setting. Preventive service, glaucoma screenings. Medicare covers the screenings once every 12 months if you're at high risk for the eye disease glaucoma. You're at high risk if you have diabetes, a family of history glaucoma, are African American and 50 or older, or Hispanic and 65 or older. An eye doctor who's legally allowed to do glaucoma screenings in your state must do or supervise the screening. You pay 20% of Medicare approved amount, and the Part B deductible applies. You also pay copayment in a hospital outpatient setting. Hearing and balance exams. Medicare covers these diagnostic exams if your doctor or healthcare provider orders them to see if you need medical treatment. You can visit an audiologist once every 12 months without an order from a doctor or other healthcare provider, but only for non-acute hearing conditions like hearing loss that occurs over many years, for diagnostic services related to hearing loss that's treated with surgically implanted hearing devices. You pay 20% of the Medicare approved amount. The Part B deductible applies. You also pay copayment in a hospital outpatient setting. Medicare doesn't cover hearing aids or exams for fitting hearing aids. So, no, remember, Medicare doesn't cover hearing aids or exams for fitting hearing aids. So if you do have a supplemental plan, it is not covered. There is some plans that have these extra benefits, so it could be, but that's just few and far between. Medicare Advantage plans do cover the most part the hearing aids. All plans are different. Some have copays and some give you an X amount of coverage limit as well. Preventive services, hepatitis B shots. Medicare covers these shots or vaccines if you meet at least one of these conditions. You have never gotten a complete series of hepatitis B shots, you don't know your vaccination history, or you're at medium or high risk for hepatitis B. Some risk factors include hemophilia, end-stage renal disease, ESRD, diabetes, living with someone who has hepatitis B, or employment as a healthcare provider who has frequent contact with blood or body fluids. Check with your doctor to find out if you're at medium or high risk for hepatitis B. You pay nothing for the shot if your doctor, healthcare provider accepts time for giving you the shots. Hepatitis B virus infection screenings. Medicare covers hepatitis B virus screening test if your doctor orders it. Medicare also covers a screening test yearly only if you're at continued high risk and don't get a hepatitis B shot. If you're pregnant at the first prenatal visit for each pregnancy, time of delivery for those with new or continued risk factors, first prenatal visit for future pregnancies, even if you have previously got the hepatitis B shot or had negative hepatitis B screening results. You pay nothing for the screening test if the doctor or healthcare provider accepts assignment. Preventive service hepatitis C virus infection screenings. Medicare covers one hepatitis testing if you meet one of these conditions. You're at high risk because you use or have elicited injection drugs. You had a blood transfusion before 1992. You're born between 1945 to 1965. Medicare also covers yearly repeat screenings tests if you're at high risk. Medicare will only cover a hepatitis C screening test if your health care provider orders one. You pay nothing for the screening test if your primary care doctor or other qualified care provider accepts assignment. Preventive service HIV, human immunodeficiency virus screenings. Medicare covers HIV screening tests once per year if you're between 15 and 65, younger than 15, or older than 65 at an increased risk. Medicare also covers a screening test up to 3 times during a pregnancy. You pay nothing for the HIV screening test if your doctor or other qualified healthcare provider accepts assignment. Medicare now covers more screenings and services if you're at an increased risk for HIV. Go to page 48. Home health services. Medicare covers home health services under Part A and or Part B. Medicare covers medically necessary part-time or intimate Intermittent skilled nursing care, physical therapy, speech language pathology services, or continued occupational therapy services. Home health services may also include medical social services, part time or intermittent home health aid services, durable medical equipment, and medical supplies for use at home. Part time or intermittent means you may be able to get skilled nursing care and home health aid services if you're provided less than 8 hours each day or less than 28 hours each week or up to 35 hours a week in some limited situations. A doctor or other healthcare provider like a nurse practitioner must assess you face to face before certifying that you need home health services. A doctor or healthcare provider must order your care, and a Medicare certified home health agency must provide it. Okay. Medicare covers home health services as long as you need part time or intermittent skilled services, as long as you're homebound, which means you have trouble leaving your home without help, like using a cane, walker, wheelchair, crutches, special transportation, or help from another person because of an illness or injury. Leaving your home isn't recommended because of your condition. You're normally unable to leave your home because it's a major effort. You pay nothing for covered home health services. However, for Medicare covered durable medical equipment, you pay 20% of the Medicare approved amount. The Part B deductible applies. Home infusion therapy services, equipment, and supplies. Medicare covers equipment and supplies like pumps, IV poles, tubing, and catheters for home infusion therapy to administer certain IV infusion drugs like intravenous immune globulin at home. Medicare covers certain equipment and supplies like the infusion pump and the infusion drug under durable medical equipment, page 40. Medicare also covers services like nursing visits, training for caregivers, and patient monitoring. You pay 20% of the Medicare approved amount for the services and the equipment and supplies you use in your home. Kidney, renal, dialysis service and supplies. Generally, Medicare covers 3 dialysis treatments or equivalent continuous ambulatory peritoneal disease per week if you have end-stage renal disease ERC. This includes renal disease, drugs and biological products, laboratory tests, and home dialysis training, support services, equipment, and supplies. The dialysis facility is responsible for coordinating your dialysis services at home or in a facility. You pay 20% of the Medicare approved amount. The Part B deductible applies. Kidney disease education. Medicare covers up to 6 sessions of kidney disease education services if you have stage 4 chronic kidney disease that will usually require dialysis or a kidney transplant. Your doctor or other qualified healthcare provider refers you to the service. You pay 20% of the Medicare approved amount per session. If you get the service from a doctor or provider, the Part B deductible applies. Laboratory tests. Medicare covers medically necessary clinical diagnostic laboratory tests when your doctor or provider orders them. These tests may include certain blood tests, urinalysis, certain tests or tissue specimens, and some screening tests. You generally pay for nothing for these tests. Let's conclude there. We will begin on page 45 next week. And it was kind of dry today, but I hope you did enjoy this. Follow us, Medicare 360, on Instagram or on our YouTube channel. I will talk to you soon. Have a wonderful day. Bye bye.